So these two machines offer us a way to inspect the inside of the lung cavity without an operation. We have tiny little fiber optic cameras that we can advance through the nostril of our patients to inspect the inside of the lungs. That allows us to see exactly what's happening under real time, and if we need to do a biopsy, we can biopsy at the same time. This is a safe procedure. Patients are generally awake but sedated, and they go home afterwards. This prevents us from needing major operations, where in the old days we used to offer patients what's called a thoracotomy, or a major surgical incision, where they cut at the side of their chest to take a biopsy. Now we can put a tiny little camera, and I can inspect the inside of the airways with the camera, do some washings, look to see what the problem is, and have an answer within 10 days. And the patient goes home with minimal complications, and it's very, very, very low risk procedure. So we can just do conventional bronchoscopy, which is just an inspection of the airways, and we can biopsy things at the same time or wash the airways, especially if we're looking for diseases like tuberculosis. And then this fancy machine is called an EBUS machine, or endobronchial ultrasound, where we have a hybrid of conventional bronchoscopy. So we've got a camera that we can visualize the airways, and on the end of that camera we also have a very small sonar probe. And so we're actually able to sonar and see what's under the airways that's hiding, which is very handy because sometimes stuff does hide under the surface of the water, and we're able to put small little needles in, aspirate these areas of disease, and see what's caused them in a safe fashion. The last piece of equipment we have here is called a cryoprobe. It's a small machine, but it packs a big punch. It is the only machine of its type in the whole of South Africa. And what this does is this applies cold energy to the center of the airways. And we use this to freeze various portions of the lung from within inside. That includes tumors that we can freeze, and we can also do biopsies of tumors and biopsies of other kinds of interstitial lung diseases. And we also use this to unobstruct airways. So if you have a tumor that's obstructing your main breathing pipe, we are able to freeze the tumor and eventually relieve the obstruction that the tumor is causing within your lung. So we're very fortunate to have this little guy. Then we have what's called on-site cytological evaluation. So a lot of the procedures we do is when we acquire tissue or a biopsy, we want to see that it's representative to prevent the patient from requiring a second procedure. And we have a pathologist that comes and visits us every week, and she looks at the specimen straight away while the patient's on the table and tells us the diagnosis and if it's an adequate diagnosis. And this allows point of care testing at the same time and a diagnosis at the same time. So patients have like a one-stop shop. This is just an imaging platform where we can look at patient CT scans and x-rays, and we've got a virtual record of all the images, and we can screen our procedures live for teaching purposes onto the screen.